Fight the spread and take a stand against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdhec.gov/COVID-19.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Happy Wednesday to you. It is Wednesday, and Coping with COVID and In It Together present Wellness Wednesday from the Diabetes Advisory Council. I'm Trey Taylor, and what's under your mask? Well, we're going to find out a little bit later on this afternoon with Dr. Candace Heath. She's going to tell us about Mask Knee. And Dr. Daniel Lackland also joins us to talk about how we can help others and ourselves with COVID. That's Dr. Daniel Lackland. Thank you again so much for joining us on Coping with COVID. We'll talk to you a little bit later. All right there, Doc?
Sounds great.
All right, great. Thank you. But first, here are your COVID community updates. The City of Columbia has extended its mask ordinance. Yesterday's unanimous vote requires a face covering and city limits through November 15th and could be extended depending on local COVID numbers. Now, the ordinance also suspends in-person meetings for city councils, boards, and commissions. Now, speaking of masks, Richland County Councilwoman Joyce Dickerson is doing a free drive-through mask giveaway. That's this Friday from 10 until 11:30. At 3606 Broad River Drive. The state Senate approved a raise for teachers. During the 2-week-long special session, they gave the okay for budget increases that also provides hazard pay bonus for lower paid state workers. It's now up to the House to pass the budget changes. Legislators also passed a bill 115-1 allowing every registered voter to vote absentee. Now, earlier in the day, lawmakers, including Wendy Brawley, tried to make changes that would waive the witness signature requirement to allow the use of ballot drop boxes. Those were voted down. And there's help virtually for parents and students learning. The Richland County Recreation Commission is offering a 4-day virtual daycare program from 8 a.m. until 2:30 p.m. and an after-school all-stars program from 3 p.m. until 6:30 p.m. Both are for students in grades K through 8 and run Monday through Thursday. They are available at 10 different locations throughout the county. Visit richlandcountyrecreation.com for more information. SCDHEC has your most up-to-date listings of times, dates, and locations for COVID testing in and around South Carolina. Visit scdhec.gov for more information, including COVID testings in Manning, Sumter County, Lexington, Florence, Camden, and Columbia. Also, check the bottom of the screen for information about organizing a COVID screening at your event or in your neighborhood. Also, the DHEC Care Line, you can find information on testing and transportation to get a test. Richland County paramedics are offering in-person COVID screening. If you're interested in that because you're immobile, call 911 for information. And maskupcolumbiasc.com. That's the place to go to get great prizes from the City of Columbia. Now, all you need to do is take a picture of yourself in a mask. Then you need to post it on maskupcolumbiasc.com. After you do that, get your family and friends to like it, and you could be a winner. It's maskupcolumbiasc.com. And the South Carolina Bar Association and SC Legal Services are offering a free toll-free number and website for rental and mortgage help. SC Thrive is offering up to $1,500 in rental assistance. Go to SCThrive/COVID-19 rental assistance for more information. And Brooklyn Baptist Church, both the Northeast and West locations, are still doing their free food box giveaways. That's happening tomorrow from 1 until 4 p.m. And the City of Columbia's 6-month payment plan is still in effect. They're offering anyone who is behind a 6-month payment plan for your water bill. They also have payment assistance available where you could get up to 75% of your bill paid. And the Richland County Election Commission needs poll workers. They've got about 1,000, but they need 1,800 more. It's a paid position, so check the bottom of the screen for more information about being a poll worker. Finally, SCDO is offering 4,000 courses and certifications for free for those currently receiving unemployment insurance. Now, classes cover everything from business to technology, health, data science, arts, and humanities. And courses are offered in both English and Spanish. People can take as many as they'd like, but you need to register by October 31st. Visit sdo.sc.gov for more information. Coping with COVID is being streamed live on the Taylor Made production page. Please go over there and like and share it. Coping with COVID is also being streamed live on the In It Together page. Please go over there and like and share that so you can get updates about living a healthy and productive life. Also going on today and every day this month on Coping with COVID, it's your chance to win. That's right. It's my birthday and you are getting the prizes. Keep listening in the next segment for your chance to win the Coping with COVID mask, 10 disposable masks. Also, body butter from Sabriti Body Butter. Deneen, the coffee queen, is going to give you a gift certificate. Also, gift certificates from European Wax Center, New York High Style, Jesus Always Sampler, and the brand new book from Jennifer Bishop. We talked to her last week. Get up and go be great. Coping with COVID and In It Together presents Wellness Wednesday from the Diabetes Advisory Council of South Carolina. Today, we're going to answer the question about MASCNY. And I see Dr. Candace has joined us. Hello there, beautiful. How are you? Oh, I cannot hear you. You're on mute.
I wanted to be quiet while you were making your announcement, but I forgot to take myself off of mute.
That's okay.
Hi, I am Dr. Candace. Thank you so much for having me today.
We are so glad that you're here. Thank you so much for joining us. I want to say hi to Michelle Kearse and everyone who has joined us today. Please go ahead and post and share this information out so we can get the message to the masses, because Dr. Candace, this is so interesting. And let me just say a little bit about you. You are here. You are a triple 1, 2, 3 board certified dermatologist and the nationally recognized speaker and expert, has been featured on major TV, radio networks, ABC, CBS, NBC, and festivals, including the Essence Festival, about talking about how to keep your hair, skin, and nails healthy. And she's even launched her own beauty care line, My Sister's Beauty. We're going to talk to her about that in a little bit. But first, I want to ask you, Dr. Candace, what is MASCNY?
So MASCNY is a condition that we're seeing a lot of. So because of the COVID era that we're living in, everyone is wearing masks. So of course we need to do that to stay safe, everyone. And I can assure you that your dermatologist is your friend. So people may think, oh my goodness, I'm becoming a teenager again. I'm breaking out. What's going on? Well, we know two things that are happening. Okay. Stress is definitely a trigger, but also the mask itself. So actually wearing the mask, even for a short period of time every day, can cause your face to produce more oil than you're used to producing. So because of that, you can develop clogged pores. We're also seeing patients develop some irritation from the actual the mask material, but primarily people are coming in for MASCNY.
Mm-hmm. And it's just a type of acne. It's a new acne. Is that what it is?
It is a new acne. And what's happening is, a lot of people are, making masks at home, and they're making them out of cotton, and they're doing all of these different things, and they are going from mask to mask to mask, wondering, why with every mask am I breaking out? Well, it's actually because you are obstructing, your follicles for a period of time, and it's really that the face, and this has been studied, especially out of studies from some of my dermatology colleagues out in China. They've been studying this, so they've actually done samples, and yes, your face is actually producing more oil. So that's making everyone more prone to acne, even if you didn't have it as a teenager.
Wow. And that's the other thing I was going to ask. Can you still get it even if because I've never really had acne. So it doesn't matter if you have it or not. Basically, Dr. Candace, if you're wearing a mask, you could get MASCNY.
You are prone to getting MASCNY. Absolutely.
Wow. So explain to us again exactly how you get it. You said because you're wearing the mask and your pores basically can't breathe.
Yeah, so you're wearing the mask, your face is producing more oil, which means that that oil is going into the mask, and then that oil is being compressed against your skin. So you kind of have a little obstruction going on, in
Yeah.
addition to the increased oil, which sets up a very nice area for acne to form. So that follicle can get clogged. So I'm seeing people who come in with blackheads, and some people are coming in with those even cystic lesions on the skin. So those big hard ones that really are painful. And I'm seeing all types of acne beneath the mask.
Wow. So can it be prevented?
So one of the things that I say, we don't know when this COVID era is going to end. So we really have to prepare as if we're going to be in these masks for a very long time. So I suggest definitely having great skin hygiene. That means that I would like for you to wash your face in the morning and wash your face at night, even if that's not part of your normal routine. And then also you have the duty to wear a clean mask every day. So I'm in healthcare. So we wear, surgical masks and things like that. But even if you're wearing a cloth mask, I want to make sure that you are washing that mask every night. I don't know how many people can kind of relate to, growing up and seeing your mother or grandmother wash their bras in the sink and things like that, for the week. So I want you to really think about your mask as something that is essential for your week. And you really want to plan it out so that you can have a clean mask every single day.
Wow. I want to ask a couple of more questions. We're talking to dermatologist Dr. Candace Grice Heath. I'm sorry. And she's in Philadelphia at Temple University Hospital. We have a question, Dr. Candace. Gary Hunter wants to know, will it be suggested that we should put something on the mask, Vicks or some type of cream that would help keep it open? I guess keep your pores open.
Oh, okay. So he really took that literally.
Yes.
So
Vicks, girl, old school. I love. Listen, I ain't hating on Vicks Vapor Rub. Vicks does everything for me. Not only
does a lot.
Girl, for my migraines, Vicks. If my head hurts, Vicks. If my back hurts, Vicks.
Vicks, people have used Vicks to treat toenail fungus. That's a whole nother, segment.
Yes.
But really, things that you should do for your skin. I'm glad you asked about that. It is becoming very persistent. You really actually want to grab some people so bad that they actually need to grab an acne medicine from the actual drugstore. So think about yourself as a teenager again. So, you can do washes with benzoyl peroxide or salicylic acid. Some people who have both hyperpigmentation, so dark spots from the acne, as well as acne breakouts. I mean, there's a variety of products. I really like products that have alpha hydroxy acids in them, like glycolic acid and mandelic acid. So those are some things that you can actually incorporate into that morning and night routine that I was talking about. That's just, that's something that you're going to have to do. I don't want to add steps, but I do want you to wash your morning and night and be strategic about what you're washing with, because one of those times should at least be something specific to help with the acne or the pigmentation or both.
All right. So let me piggyback off of what you said. Thank you, Gary, for your question. So you're saying, one, we need to wash the mask every day.
Yes.
And preferably have 7 masks, I guess.
Or at least be able to have a routine where you are, cleaning them. So that's why I gave you the idea of think about some of the older members of your family who may have washed things in the sink and hung them up, because they may not have had enough for a fresh one for every day. So that means that at some point you're going to have to kind of hand wash or do whatever, hang them up so that you can have enough to make it through the entire week.
Right. Now, you said, of course, we should be more vigilant in cleansing our skin. So you said morning, night. Should we be cleansing it throughout the day, like in between our mask wearing? Is that too much or not enough?
So I don't want you to overdo it. So I try to get people to really just commit to morning and night. The only people that I actually get to do an additional, very gentle wash in the middle of the day is if they're doing a lot of heavy activity. So if they're working outside, they're doing a lot of sweating, they're actually like having a full workout, then I definitely would suggest an additional one, especially if they're doing all of that in the mask and it's going to be several hours before they have their nighttime skincare routine. But typically, I just don't want to overwhelm people. So just morning and night is quite enough.
Yeah. Now, what about makeup, Dr. Candress, for ladies? Now, I think we've all recognized you can't wear lipstick under those things because they obviously they ruin the mask. But should we even stop? Just put makeup on the upper and not on the lower? Just have a half and half thing.
I'm only wearing makeup today for you and your viewing audience. So for COVID, I really want people to embrace their natural skin. This is your time to work on it because the more things you layer, then you put the mask on, you're going to have more an increased risk for breakouts and irritation and more oil production, right? So we really want to limit what we're putting on. I mean, I do have some patients and friends who are just diehard makeup fans, and they've been getting very creative with their eye makeup, and I think that's totally fine. But hey, take advantage. Give your skin a break. Let's do something. Think about this as doing something good, so we can just be natural and look fabulous when we walk out.
You telling the sisters don't go outside, don't wear any makeup? Is that what you're saying?
I mean,
right now?
Especially if people are not going to even see it from here down.
Right.
Free yourself.
Free yourself. Listen, Gary has another question. And Gary, I've never heard of this. He wants to know about spraying a little Listerine as his mask.
So
I gargle with Listerine.
Why are people, I always tell people when they're telling me about remedies and things that they've tried that may work, that sound crazy, there has to be some component of it that is helpful in some way. Is it because you like that it kind of opens up the nasal passages and you feel like you can breathe more because of the ingredients? Same thing that he was asking about the vapor rub. So maybe he feels like he can breathe better through the mask if he has that. So I can't really be a proponent of that, but I really like to always, instead of just discounting something and saying that sounds crazy, I don't know why you would say that, there's always a reason why it makes you feel better. So I don't know.
So you're saying if it doesn't hurt, go for it?
If it's not harmful, then you can go ahead and do it. If you start having issues, consult with your dermatologist or your physician to talk about what's happening. What is it that you're trying to treat, actually?
So, Candress, how long does the mask need last on your skin, or does it depends upon the person?
Ooh, I do not want to be the bearer of bad news. But
come on, give it up, turn it loose, girl. Just tell it like it TI is.
If you keep doing what you're doing and you don't make any changes, it's not going to get better. Because we are not going to come out of this COVID mask wearing era for a while. So that's why it's important that you get your skincare routine under control right now. So if people decide to go ahead and take the leap and start to actually, incorporate something in their plan that can help with some of the breakouts that they're having, then guess what? They can start to see a difference within a matter of weeks. Wow. So I cannot guarantee 2 weeks. I cannot guarantee 6 weeks. Some of our acne medications, actually the prescription ones, and there's actually one that's over the counter that used to be prescription, takes about 6 weeks for you to really start to see a difference in your skin. So I try to tell people, think about that 6-week time point to say, okay, am I breaking out less than I was before I started this regimen? Right. If I am breaking out, is it lasting as long? So if it's not lasting as long, that's also a treatment success. So we are on the right track. So reframe, your microwave kind of theory. I'm going to use this one time, I'm going to be cured. No. So think about, kind of give yourself about 6 weeks to think about, okay, I'm going to really stick with this and I'm going to see what happens next. So I would say about 6 weeks if you're really trying to commit to a new treatment program.
Wow. And like you said, you've got to do everything. You've got to make sure your masks are clean. You've got to wash your face every, twice a day. Yes. You've got to use whatever those creams are. So you've got to be consistent in your regimen to see a change if you are being affected by maskne.
Yes, you do. Yeah. You have to be committed, and no one's perfect, and you don't have to be perfect. I know some people are going to miss steps here and there, and that's okay. And also sometimes we cannot control the amount of stress that we're under. And I know that stress alone can cause acne breakouts.
Wow.
So some people, they have it from both things. The mask is making it worse. They're very stressed because of what's going on in their home, their work life, or they're now having to work and become a teacher as well all overnight. So, there are many reasons to be stressed.
Yeah, that's such an interesting point that you make, that acne could actually that stress could cause acne.
Yes,
that's
absolutely.
Very interesting.
That alone, without the mask.
Right, even if you're not sweating in your mask or your oils are not. Yeah, wow. Michelle Kearse wants to know, Dr. Kandris, are masks with filters a better option? Thank you, Michelle, for your question.
Oh, that's a great question. So really, it's not about whether it has a filter or not. It's often about the material and how much your skin reacts, how much your skin is producing oil. So no, as far as maskne is concerned, then the answer is no. So.
Right. So is there a better option for masks? Or is cotton better? Are the disposable ones better? What would be the best mask to prevent maskne?
So for people who are not in the healthcare setting, I will recommend that they use cloth masks because they are easy to launder. So they're easy to keep clean. It's quick. You don't have to do anything special. So that's why I would recommend a cloth mask, made out of cotton. Would be great for you to use. Something that you can actually wash and reuse.
Yeah. Thank you, Michelle. Gary Hunter said the Listerine was to kill the germs.
Oh, okay. Now,
so here's my question: the germs in your mouth or the germs in the mask?
I'm like, is he talking about he's trying to kill corona with Listerine?
Right.
If I say yes to that, this is going to go viral, and then we can't. Listerine's going to be on back order,
right?
So we can't say that.
Don't say that.
So if you're
don't channel your leader by saying coronavirus can be cured by just a little Listerine. Just gargle with a little Listerine. Put it in your mask.
Right. So let's dive into that. So he's trying to fight the bacteria, right?
Yeah.
So some of the acne medications, one of the ingredients. Let's go with benzoyl peroxide, which is a very common ingredient in over-the-counter acne products. Does help to reduce the amount of bacteria on the skin that can make acne worse. So if you're looking to get at the bacteria, I would say, Gary, one of the things that people can do is that they can actually use benzoyl peroxide containing product over the counter that's designed for acne. Those definitely will help with decreasing bacteria.
Yeah. Thank you, Gary, so much for your question. We appreciate it. We are talking about maskne. It's the acne that you can get from repeatedly wearing your mask, having stress, as Dr. Kandris said, and not cleansing your skin thoroughly. And we've been talking about maskne. So you mentioned a couple of products that folks can get over the counter. Tell us about some of the products you would recommend to help if you one, have a breakout, and two, maybe to prevent a breakout. I don't know if you can do that.
Right. So when talking about acne or maskne in general, there are different categories of things. So often I ask people about what they already have at home. So sometimes you have people who I call you product junkies behind your back. So you have you try something, 3 times and you buy something else and you have multiple products. So I try to work with what you have, but what you should have, here are your major categories. A cleanser. So you need to have a gentle cleanser. And then you need to have a cleanser that it has a lot of your actives in it. So that's going to be, if you're having a lot of breakouts, something with benzoyl peroxide or something with salicylic acid in it, or, like my product, My Sister's Beauty, the brightening wash has mandelic acid in it. It has other ingredients that can help with dark spots on the skin. It can help to give you a nice glow. It can help even with some blemishes as well. So you kind of have to have like a powerhouse cleanser. And then that other cleanser can be super gentle. So you want to kind of go in on the skin with something that is, more intense. And then that other time the other time that you actually cleanse, you want to do something gentle. So a gentle cleanser, even something like Dove Unscented or CeraVe Hydrating Cleanser. These are examples of cleansers that are super gentle that you can find anywhere. Right. So powerhouse cleansers, and then a super gentle cleanser to kind of rescue just in case you're getting a little bit too dried out. And then the other thing that you need to have in your program is a moisturizer. And I actually challenge people to have 2 moisturizers within their reach if they can. So a moisturizer that has sunscreen in it, because that can actually be used in the morning time before you go out and face the sun. A lot of people talk about dark spots, but guess what? If you go out in the sun and you're not wearing any type of sun protection, those dark spots can just get darker. So even beneath the mask, the sun rays are actually penetrating those areas. So I still recommend that everyone, regardless of skin tone, wear moisturizer with sunscreen in the morning. And then in the night, at night, if you are feeling super oily, then you may skip the moisturizer. But if you've just used that powerhouse cleanser and you need something to kind of really help your skin to recover, then you can definitely use a moisturizer, nighttime moisturizer that can help to soothe the skin. You know, for an example, my Sister's Beauty Recovery Cream definitely is packed with ingredients like aloe that can help to soothe the skin. And that is just one example of a nighttime moisturizer that you can apply. Also, CeraVe PM is another example of one that you can just get from the pharmacy. And again, for every single product that I name, there are 50 more just like that. Right. But I want you to start thinking about them in categories. Gentle cleanser, a powerhouse cleanser, a recovery moisturizer, and one with sunscreen. So if you think about those categories, you don't get so confused when you get into that long beauty aisle that has the 1,000 products in it, right? That I love so much, right? Yeah. So exactly. Yeah.
Okay. All right. So you mentioned that we should put on sunscreen. Now, are we putting on the sunscreen and then putting our mask over it?
Yes. And so I really recommend when people are doing facial moisturizers with sunscreen that they actually purchase one that's designed specifically for the face, because the ones that are designed specifically for the face are going to be much lighter weight than the ones that are designed for the body. See, that's a dermatology pro tip. Yeah. People think, I'm just going to get the one for the body. I'm going to rub it all. And you can do that. You can do that, and that's totally fine. But when you're thinking, especially for my patients who are more acne prone, I always want to go the lightest possible so that we are not having more oil. And also, it's something else you may not have thought about, when you're selecting that moisturizer with sunscreen, make sure that it says oil-free.
Oil-free, because you don't want to put more oil back into your skin.
Right. Or doesn't clog the pores. And then here's a fancy one.
That's good.
Non-comedogenic.
Right.
Non-comedogenic. That means that it does not make acne worse. It's just saying it in a fancy way.
Yeah, that's good, Candrace. Thank you so much. That was a really good tips to know, because we've got to do something about, again, it's women and men, just protecting our skin. And making sure that, because like you said, I think we're going to be wearing masks for a while.
We will be. We will be.
So we need to prepare, whether you've had it or not yet. Prepare now so that you can, hopefully prevent, prevent getting it. All right. So you have, in addition to all of this, you have your own skincare line, My Sister's Beauty. Congratulations.
Yes. And thank you so much.
Absolutely. And you've mentioned it a couple of times today. So tell us about that. We're going to bring the website up, but tell us about My Sister's Beauty. Here's some information. That's your beautiful self with all your products.
Thank you. Thank you. So My Sister's Beauty has been in the making for quite a long time. And what I wanted to do was to select something that really targeted some of the things that people hate the most. And those things are blemishes, dark spots, and just overall the skin looking very dull. And sometimes people can't really put their finger on exactly, what it is, but their skin just overall looks dull. So I really loved a procedure called chemical peel. So chemical peels, you put it on, you pay, you put it on. your skin kind of peels, over a week period of time, and you kind of get this glow. So what I decided to do was include some ingredients that would do that. So kind of brighten the skin over a longer period of time, similar to what, you would get with that. So it's packed with ingredients like mandelic acid. It also has other ingredients, some vitamin E, etc. So lots of things that can really help to brighten the skin. And I see up there you have at My Sister's Beauty for the social, and it's actually it's at My Sister's Beauty official, because we are the official destination for people looking for a new glow to their skin. So there is a cleanser there, and there's also a recovery cream, My Sister's Beauty recovery cream, because I'm going to hit you with that powerful cleanser. And then at night, we're going to need to recover and restore some of the moisture so that when we get up in the morning, we are all set and ready to start our day. Awesome. So I would definitely suggest the My Sister's Beauty bundle, both the cleanser and moisturizers, and actually just for you, because I just love this platform. I love what you are doing.
Thank you.
If people out there listening would like to give it a try, you can certainly go to www.mysistersbeauty.com. If you put in the promo code beauty, you will get 20% off.
Wow.
I was not even supposed to be running this promotion. But I'm on fire. The people are, they are responding.
Yeah.
I love what you are doing. Thank you for the invitation. And actually so much so, people don't even know this. I'm away right now on kind of a socially distanced honeymoon because I didn't get to take one. So I told my new husband, I said, it's important for people to get the facts.
Yeah.
And anytime someone recommends and they said, look, I really want you to do this. This is a great person, a great platform. I said, you know what? I said, honey, would you mind if I took a little time out to talk to some people who really needed to know? He says, yeah, that's fine. That's fine. So anyway, I'm on my honeymoon. So I'm feeling great. Y'all go ahead and put in beauty in the promo code. Now, I'm not going to be able to, get the fulfillment. So your delivery will not go out until next week, but go ahead and put it in for me and I will get it taken care of when we get back home.
Thank you so very much. Mitchell Peace Georgianne says, thank you. Thank you so much. Congratulations on the wedding. I know Dr. Nicole, who is a contributor to Coping with COVID, she said you were on a honeymoon, but I thought you had come back. So thank you.
No, I'm there.
Well, listen, girl, go on back with your new husband, and thank you. Because far be it from me to take you away from that. Listen, Candrace, such great information. Thank you so very much. We definitely are going to go over to the website and again, put in the code BEAUTY for 20% off.
Yes.
And we would love for you to come back after the honeymoon and talk to us some more about it. Dr. Candrace Heath, she's a triple board certified dermatologist. She practices in Philadelphia, Pennsylvania, and she's a brand new wifey. So So again, I think we have all of her information up. If we can get all of her information up, people can visit her on Facebook, Instagram, and also on Twitter at Dr. Candrace and get more information about Dr. Candrace. Again, thank you so much. You see the information up on the bottom of the screen. Candrace, again, thank you so much for joining us. Good luck to you, girl. Congratulations.
Thank you, everyone.
And we'll talk to you soon.
Bye-bye.
All right. That's Dr. Candrace Heath with My Sister's Beauty. She's a triple board certified dermatologist. We are so appreciative of her spending some time with us here on Coping with COVID. Please make sure you go to her website, My Sister's Beauty, and order some products. And as Michelle just said, the promo code is BEAUTY, and you'll get 10% off. Mitchell Peace Georgianne says, congratulations, Dr. Candrace. Hey, we want to say congratulations to you too. You know, September is my birth month, but we are giving you the prizes. That's right. Coming up in the next segment, after we talk to Dr. Lackland, your chance to win the Trey's birthday giveaway. That's coming up next on Coping with COVID. I'm Trey Taylor.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Hey, good afternoon, guys. I am Denise, the Coffee Queen, and it's Trey's birthday. And as we celebrate together, guys, we're giving away free coffee gift certificates. That's right, free gift certificates every single day during the month of September. And a bigger gift on her actual birthday, which is September the 13th. We're giving away one of our specialty gift bags full of gift and coffee goodies. Guys, but it's just not any coffee. Premium specialty coffee is what we're giving away. Organic is an Arabica bean from South or Central America. Blends like Feel Soul. Yes, blends like jazz, guys, because she's a jazzy type of woman. And blends like New York, because that's where she hails from. And don't worry, tea lovers, I got you covered. We're also giving away some organic teas. Yes, we found a vendor that we can provide some organic teas to you as well. Use your gift certificate for yourself or for someone else. And for that additional savings, guys, visit us at www.thecoffeequeen.com. Hit the services tab, and guess what? You'll find our subscriptions. Guys, that's right. It's Trey's birthday, and let's celebrate together with her as Deneen, the Coffee Queen, gives away coffee every single day on Coping with COVID with Trey Taylor. Have a wonderful day.
You are watching Coping with COVID with Trey Taylor. In It Together, and Coping with COVID presents Wellness Wednesday every Wednesday, courtesy of the Diabetes Advisory Council. Hey, don't forget, as Deneen said, she is giving away a great prize pack, as are all of our other sponsors. And coming up, after our interview with Dr. Lackland, you will have a chance to win. We talked to Dr. Lackland back in July, and he's back to discuss how we can help protect ourselves from COVID and find a cure. Dr. Lackland, thank you so much for joining us today. I appreciate you.
Wonderful to be here.
Thank you. So I know that you're working with trials and testings. Where are we with a treatment for COVID?
On the good side of it, every day, almost every hour, we're making progress. And that can be from the observational studies where we're seeing how many people are getting getting COVID, how many people are becoming infected. And better yet, how many people are dying and actually getting better. And every day we're seeing that with new treatments and with great progress towards a vaccination.
That's great. Now, we're getting ready to come up on flu season right here, smack dab in the middle of COVID. How does the flu affect COVID?
Well, Trey, one thing we don't really know for sure, except we know it can't be good. I mean, you can't have the flu and have COVID and think that that's going to be a good thing to have. We don't know the absolute, and I think it's important to know that it's so important that the flu cannot be something good to go with the COVID infection. So therefore, you want to prevent the flu as much as possible. And so you want to get a flu shot, and you want to protect yourself as much as possible. And in particular, at a time when you have another condition like COVID-19. And I think just to add to that, and I know it's a little bit off, but also with hypertension and with diabetes, we can't we couldn't say, all right, well, because we got COVID, I'm going to go ahead and get the flu. We also, with nearly half of our population being hypertensive, including myself, I have to make sure that I'm going to control my blood pressure. And with diabetes as it is, and I'll make sure that I'm also bringing that in there too. So adding to the flu, we have diabetes and hypertension.
Wow. Is it more important now to get your flu shot than before?
I would say yes, because I think if you have both infections, that's just not good.
Yeah.
So you want to, and if you can prevent the flu, and if you can, take all the precautions for COVID, and we will have a vaccine for COVID soon. I think we will have good treatments, and so, but right now we're not. While we're learning, we still have it as a bad pandemic that goes on, and we want to avoid the complications that might be associated.
So when should we get the flu shot? What's the ideal time?
Typical recommendations about, I think now if you go into a lot of different stores, your grocery store, your drug stores, the flu vaccine is becoming available now. So this would be a good a good time. It's really right at the very early stage of it, but between now and throughout October. And again, it's one of those things we don't know for sure, but kind of the earlier you get it, in one sense, the better off you are.
Okay. So why does the flu shot, us getting the flu shot, help with COVID?
Again, because you're preventing another an associated condition. So you want to be able to battle COVID-19 as best as possible. Ideally, we don't want to get it.
Right.
And if we do unfortunately get it, which people will because we don't have the vaccine yet, if you do get it, you want to be able to have your immune system as strong as it possibly can. And you don't want to complicate another infection with the flu, with hypertension, with diabetes that you've identified. Yes.
Yeah, I want to thank everybody for watching Coping with COVID. Dr. Daniel Lackland with MUSC is here talking about vaccinations and COVID. Michelle wants to know, Dr. Lackland, why is there still so much controversy surrounding the flu vaccine since it's been around so long?
That's a wonderful, wonderful question. And I guess with all vaccines, and this is just something that's inherent, there are some people that do have complications. And sometimes those get promoted and people see that and think about these other conditions. And then others, there are some people that they get the flu vaccine, they still get the flu. And they say, oh, well, that didn't. But when you balance it out, we're all much better, particularly those of us that are vulnerable, that are older. We definitely need to get the flu vaccine. We know that the flu shots work, and we know it decreases our risk of having the flu. And in this particular case, at this particular time, doing that is the most important. But it's a wonderful question, and I do think that the benefits now, particularly now, of getting the flu shots are so very important.
Yeah. Thank you, Michelle, for your question. I'll piggyback on her question because we had a pediatrician on a couple of weeks ago talking about making sure your kids get vaccinated. Yeah. And one of the questions were, does the flu vaccine give you the flu? And a lot of people think that, Dr. Black.
Yeah, it's because a long time ago, that was the vaccine actually was giving somebody a milder case of the flu, and sometimes you hear it, and sometimes that was the way it was referred to. But today, that's not the case. Today, you're getting something that improves your immunity to the flu. So you're not getting the flu. And this is something that's going to help you not get the flu.
Right. And I was going to ask you now, you talked a little bit earlier about how getting your flu shot can help you. So are we more susceptible to COVID if we don't get the flu shot?
The proper answer is we're probably not sure because we just don't have the data and the results that are there. But so from that standpoint, you're not really sure. And I don't think that if you got the flu shot, you should say, okay, now I'm not going to get COVID,
right.
So I'm going to go out and expose myself as much as I can. You don't want to do that. But by getting the flu shot, not having the flu, in the event you do get COVID, it's going to improve your chances of a speedy recovery, and it's going to make the therapies a lot better because you don't have the flu to counteract it, much like the hypertension and diabetes.
Right. We're talking to Dr. Daniel Lackland with Medical University of South Carolina, MUSC. And we've been talking about the flu shot and COVID and why it's so important right now, as Dr. Lackland said, to get your flu shot, because what you don't want to have is flu and COVID. I mean, We've got these two viruses out here, and 'tis the season for the flu shot. So let's go back to vaccinations, Dr. Lackland, if we may. The COVID vaccination, where are researchers with it?
Well, everything that I'm seeing is just like you, Trey. We're seeing the things that are there, but it looks like the progress has just been very, very good. And in one sense, a lot of resources have been put towards the people say, well, why does it take so long to get a vaccine? And typically, if we think even back many of the things where we have a vaccine, it takes a long time because you're having how fast you're able to do the trials and actually do the studies. And you do a study to determine, one, the effects of it, the protection of it, and then a very important aspect of that trial is to make sure that it's not hurting somebody. So it's great that it might be protecting you, but if it's also giving you another disease or another condition. So that's what takes so long with regards to the study and the development of a vaccine. In this particular case, they're doing multiple studies, multiple tests for a vaccine, multiple developing, and also kind of expediting it, in which you're looking at both the benefits as well as the potential harm that they would be looking almost at the same time and expediting it. And then again, putting that forward, it's a real exciting time. And everything that you're seeing is, as we would look at the results of the preliminary results, it looks like they're making very good progress, and it doesn't look like it is causing a lot of harm. You saw one study that was stopped, that was very prominent in the media, that it was stopped, but it was stopped for a very short period of time because they figured it out, and they were making sure that they weren't doing a lot of harm. So that's just real exciting. The other piece for me and for you and for all of us that we can be excited about, it's while this is being expedited, it's not being just frivolously just done.
Right.
So, okay, we're going to throw everything aside and we're going to come up with a vaccine, and we don't know what it's going to do, but we're going to come. That's not the case. This is being done very, very scientifically, and it makes me feel very, very good that we're going to come, that when we do find one, it's going to be good and it's not going to be harmful to us.
Now, is this going to be a cure or a vaccination? What are they working on?
It'll be it's a brilliant question. So you'll have a vaccine for people that will hopefully will prevent people from getting it. It's not going to be a cure, but to your point, the treatments are just coming out. I mean, it's every day. It's almost every hour. I'm getting a message, a buzz that this new therapy is coming about. And to have so many different therapies, and it's almost like hypertension, where you have a lot of different hypertension. You say, well, that drug, that didn't work for me, or that made me retain fluids or whatever, or maybe go to the bathroom more or whatever. So that's with hypertension. We're going to almost see the same thing with the treatment of the COVID-19, where if one therapy doesn't work for one person, it might work better for another. And that's a real exciting piece. And just as you just described it, so we'll have something to prevent for the future. And then for those that are infected, that do have complications, we'll have something that will treat, which really can show us a day that right now we want to control the COVID pandemic, and we want to make the pandemic go away by controlling it. But then I see one day when maybe we really do have the vaccine and we prevent it, just like we've done with polio and with certainly with smallpox, and the way we're doing even with measles.
Yeah. Michelle wants to know, she says, in relation to COVID symptoms, she said she's heard several people lately speak of symptoms similar to allergies that now could be COVID related. What isn't a COVID symptom? Yeah. What isn't a COVID symptom at this point? That's funny because everything. Yeah. Look, because, your toes are big. You got COVID,
It's a great question, and a little bit we're refining that every day so that you could start to have the symptoms. But just as we've all kind of said, sometimes you have a cold at the same time that you have the COVID infection, and so we're learning to be able to distinguish. We're certainly learning there with test, and that's it's a great question, but it's also very similar to the flu. If I said, "Hey, how many of us have had the flu?" Well, I'm putting my hand up.
Right.
And then you ask me a little bit more, is how do you know you had the flu? And I'm saying, well, I felt like I did. I had the symptoms associated with the flu. And in some cases, I had a real bad cold, and I didn't necessarily have the flu. But it's a great question, and I think, Michelle, and as we kind of develop and refine the symptoms, we'll be able to build it forward. But right now, because also there's so many people that are asymptomatic, that really just have minor symptoms, that's where we're saying probably the testing that you've been promoting over and over, Trey, I think is so important.
Yeah. So to Michelle's question, what are, she said, what is not a symptom? I mean, we know fever, sore throat. We've heard blood in your coughing, the COVID toes. Are there any new symptoms? What's the latest?
Hey, Trey, you know what? There are every day.
Yes, there are, Dr. Lackland.
You're seeing this is a bad virus. This is not and we're seeing symptoms that we didn't see, and that's picked up with diagnostics. And so, for example, we've heard that the COVID-19 is associated with myocarditis, and there's been some work that's been in that, and particularly, unfortunately, in the young people. And now that's not a real common symptom, but that's something that we're learning every day. Every day we learn that this virus can attack another system, another part of our body, and give us different types of symptoms. It's a wonderful question. We're learning more, and I think very soon we're going to see, as we bring the diagnostics and we see people that are truly infected, that we have good diagnostics on that, and we see that the symptoms that they have that were different, I think that's going to help us with that great question that's here. And I think in the future, then we really will have, I've got the symptoms of COVID and I need to do things beyond just taking a guess and getting tested.
Yeah, Dr. Lackland with MUSC is here. Please continue to post and share this information out so we can get this important information to the masses as we stream live on the In It Together page and, of course, Tailor Made Productions. So, Dr. Lackland, we're going to wrap up. I know you've got to go. You are a real doctor and instructor out here. But I want to talk a little bit in the couple of minutes we have left about trials. We know that within the testing comes trials, because you've got to test the vaccine on folks, right?
Brilliant. Yes.
Yeah. So why, where are there trials going on over at MUSC?
Absolutely. And they're going on right now. And there are numerous trials all over the country. And the way we're going to get rid of COVID-19, the way we're going to remove it is through good, solid, randomized control trials that are going to give us the evidence that we know that we can very with confidence answer these wonderful questions we're getting. But we've got to have that trial evidence that's so strong that we know and can have the full confidence to say, yes, this is what you should be taking, and this is how and answer your questions very precisely. So very important. And I thank you so much for bringing this up.
Yes, sir. So to participate in a trial for COVID, for instance, do you have to have had it? Do you have to have it now? Or do you have to be COVID free?
Hey, you know what? You can have any of those
Okay.
would fit very well for the studies that we have. We have trials for the treatment of COVID. We have trials that are looking for if you have had it, how do you make sure that you don't ever get it again, so to speak? And that's looking at the immunity. And then certainly there's some great trials for the vaccines of how we're going to prevent it. And not just with the vaccine, but other types of things that you can do that we were discussing, wearing the mask and how do we wear it. There's studies to go about of there. But it's to what you suggested, and I think it's so very important. The studies are only good as the people that participated. And so it's so important that everyone, because we're all infected, there's nobody that's not at risk for COVID-19 or is not affected in some way or another.
Yeah.
So for these studies to have value, it's critical for all members of the population to participate, because if you don't, then you only know it works in this group of parents. So if there was a study being done in elderly population, then you're going to say the question, well, what about adolescents? Does this work for them? And the answer then becomes what I've given you is, I don't know.
You don't know unless you have
absolutely
someone to test on. So does that mean not only every ethnicity and every age group needs to participate in trials?
Absolutely. And I think if we can get that, because then we would have results that would be applicable to everybody, and we would be confident that they were, rather than taking a guess.
Right. So you need men, women, and children of all ages, all genders, people of color, African Americans, Native Americans, white folk, like, black folk, everybody.
Brilliant.
So how do we find out about trials going on?
There's a number of ways. Some are just they are advertised, but I'll even speak for myself. They're kind of difficult to get in. You could difficult to find sometimes. Certainly, your healthcare provider would provide it. There's if you look on things like the MUSC website, as well as other healthcare provider websites, hospitals and things, and looking in there. And I think it's an easy search on the internet. It's basically COVID trials COVID studies in my area, and that should pop up fairly quickly, but easily. MUSC, USC, Greenville, everywhere. I think if you made a call to your healthcare provider and said, "I'm interested in a study," you should be able to be easily referred. And certainly DHEC is a wonderful source too of that information as well.
Right. We've got one more question from Michelle, but before we go to her question, I want to ask, is there a specific need? Are you lacking in an area having participants for trials?
It's a wonderful question, and you could say, and I guess I've been saying that all day, right? But you could say, we're always, all these studies need as many as you can, because what we're trying to do is to expedite the studies.
Right.
And that's based on how many people are participating. And so if you had lots of everybody participating and we had a full coverage, then we're not we say, oh, now we need to do a study among elderly Caucasians. We don't need to do that now, because if we've got everybody participated, we know that we've got everybody included, and these were the results, and this is how we can do the therapy. So in this case, truly, the more the merrier.
Right. Michelle Harris wants to know, are people who have had COVID still being asked to donate blood plasma? Do you know?
It's a very, very fair question. My understanding is yes, and so I think that is there, and I know that the people that were doing it, I think, are still doing it, and I think that is. I don't know the magnitude and how much the quantity that is there, or what the specific needs are, but I know that still is going on, and that still is it's a possibility. Yes.
All right. Dr. Lackland, MUSC, thank you so much for joining us again today on Coping with COVID. Please, as we talked about before we started the show, please let's communicate about what your needs are, particularly involving the African American and Hispanic community, so that we can get that information out. There is a stigma attached, particularly for people of color, around trials. So I want to do what I can do to help dispel those negative connotations, and to work with MUSC and you to get the types of peoples in the trials that you need. I would volunteer. So one more question. Do you pay to volunteer to the trials pay?
Some of the studies do. And some do, some do. You know how that works.
Oh, yeah.
But it certainly is there. And I guess at a minimum, you're making a significant contribution to society.
Right.
And some of them actually have some resources for you, travel and that type of thing. And then others actually have an amount that they're. So different studies, different trials, all in all. But the major contribution that you're making to humanity, to all of society, I think is great. That makes a major accomplishment there.
From the Medical University of South Carolina, Dr. Daniel Lackland. Thank you so much, Dr. Lackland. We appreciate the work that you're doing, and we appreciate you coming and talking to us today on Coping with COVID.
Indeed, my pleasure. Thank you.
Thank you. Thank you. All right, Dr. Daniel Lackland. I'm Trey Taylor. You're watching Coping with COVID. In It Together presents In It Together Wellness Wednesday on behalf of the Diabetes Advisory Council. It's my birth month, and you get the prizes.
It's your birthday, shout.
That's right. It's my birth month, and you get the gifts. A Coping with COVID reusable mask, 10 disposable masks from the City of Columbia Office of Business Opportunities and Palmetto Media Connection. Sabriti Body Butter and Lip Balm, a free service from the European Wax Center. Gift certificates from Deneen, the Coffee Queen, and New York High Style. A Jesus Always sampler and J. Anthony Brown's Hotter Than a Mofo products. It's my birthday, and you get the gift. And it's time for you to win right now on Coping with COVID. Good luck.
All right, it's time now for you to be a winner. We talked to Dr. Candris Heath, triple board certified dermatologist working in Philadelphia at the Temple University Hospital, about mask knee. It's acne that happens from wearing your mask. She gave several tips to help us through the, she gave us several tips to help us connect with and to do better as far as it's concerned. So please let me know, anyone, the first person who can tell me what was one of the tips that she gave us. What was one of the tips that Dr. Candris gave us? Let me know, and then you will win that Coping with COVID prize pack. One of the tips that we received from Dr. Candris. All right, I'm still here? Yeah, one of the tips. All you have to do, I see myself several times. All you have to do is post it right there and you will be a winner. Okay. While we do this, let me tell you about what's coming up the rest of the week. Jay Halim joins out. It's two places to talk about learning pods. That's right. Learning pods. Are you having some problems with your young people because they're all over the place and you're at home and nobody knows what's going on? Well, learning pods. Jay Halim is going to join us tomorrow. And then on Friday, Faith Friday with Ron Best with Zion Pilgrim Baptist Church, Rich Text. That comes your way this week on Coping with COVID. While we're waiting for you to answer the trivia question, as always, I leave you with a reading from Jesus Calling. And today it's no different. It says, I designed you to live in union with me. This union does not negate who you are. It actually makes you more fully yourself. When you try to live independently of me, you experience emptiness and dissatisfaction. You may gain the whole world and yet lose everything that really counts. Find fulfillment through living next to me, yielding to my purpose for you. Though I may lead you along paths that feel alien to you, trust that I know, Jesus says, what I'm doing. If you follow me wholeheartedly, you will discover facets of yourself, that were previously hidden. I know you intimately, far better than you know yourself. So come to me so that you can be in complete closeness. You are transformed more and more into the one I designed you to be when you are close with me. That's your Jesus Calling for today. I'm Trey Taylor. If you know the answer to the question, one of the tips that Dr. Candris gave us for mask knee, post it in the comments either now or during the replay, and you'll be a winner. I'm Trey Taylor. Until the next time, I wish you peace, abundant blessings, safety, and reminding you, please wear your mask over your nose and under your chin. Have a great day.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Palmetto Media Connection, established in 2010, connecting media and communities together, hosting annual media socials and also bringing awareness to our communities. We are proud to sponsor Coping with COVID with Trey Taylor, and during this month of September, we say happy birthday, Trey. Find and like us on Facebook, Palmetto Media Connection, connecting media and communities together.